Good afternoon, evening, members, and welcome to our AAIP webinar, which I guess we should start saying.
The IDS webinar. Yes, that's right.
We are still the AAIP, but we have changed our name to the IDS, the
Institute for Dental Specialists.
So we are practicing saying that ourselves. So that is what we are going to start going by, which is powered by the AAIP.
Yeah, and really, in considering this, we are not an association. We're not a membership association. I mean, yes, you're all members, but when it comes right down to it, what do we do? An American Association didn't describe it very well. And besides, we have specialists who are members of this organization who are not periodontists. So we decided we are a teaching institute. That's what we are. So we're the Institute for Dental Specialists.
Yeah, and that was one move for us forward to find more things that we can do for our members, and we've asked and we've listened to hear what it is that you guys need, what it is you guys want to hear more of, and so the changing the name was one way of us moving forward to make some pretty big changes. And one thing as well is, starting in 2018, we are going on tour, so we're going to be coming to or close to your area to open up some of our seminars, some of our workshops for you and your staff, so we can get a little closer, get some hands-on, and actually physically be there to help you with some things to help you increase your practice.
So the first one that we're going to is we'll be in Portland, Oregon on December 2nd. That's Saturday, December 2nd. And we were invited by the Oregon Society of Periodontists, which is nice, Dr. Michael Matsuda, who's the president. And so that's going to be for doctors and staff. So if you're in Washington, Northern California, contact Michael Matsuda, M-A-T-S-U-D-A, and figure out how you can go. That'll be a morning program on Saturday morning.
We also have one in January in Arizona. I don't really know quite the date of that one.
It will be in Phoenix. It's around January 20th. I think it is January 20th, but more notification will come, and that's for the Arizona Society of Periodontists.
Correct. Yeah. So, and those were just the two that we know of now. We are going to try to find at least 5 more locations for 2018, and we will keep you posted.
Oh, I didn't tell you one. We're going to Salt Lake City in April.
All right.
So, yes. And that's for the Intermountains
Society
of Periodontists.
So we know 3 of them, so 4 more to come. What a surprise.
There may be 5 more after that. So, yes.
We're just going to buy a camper and just going to hit the road.
That's right.
All right, guys, so tonight we are continuing our internal marketing. And to give you another sneak peek at something else that we do that helps us with that internal marketing. So today, as always, we will show the video. We will discuss a bit more about the video afterwards and then put it into action next week.
So let's continue our talk on internal marketing. Internal marketing is extremely important, but it has to be implemented. And these strategies need to be implemented one by one. You know, we've spent now 2 months. We're now on our 3rd month talking about internal marketing. We're intentionally spreading it out so that you have the opportunity of looking at it and putting in each strategy. It may take you a little bit longer than 3 months. That's okay. As long as we're looking at a strategy, putting it in place, and making sure that it's successful, tweaking it if necessary, and then going to the next strategy. Each one of these strategies, once they're put in place, only requires some monitoring in order to be able to make sure that the strategy is actually working and that you are adjusting as you need to make mid-course corrections in order to get the most you can out of the marketing strategy. Well, let's talk about a marketing strategy that I use. And you may look at me funny. I'm kind of used to that by now. So it is the POT4 strategy, post-operative treatment number 4 strategy. And we've been using this POT4 strategy for at least 7 years or so.
Right. Well, we've always had a post-operative treatment 4, and that means their final treatment, their final check after treatment. And that's usually where you make sure the dentist has done their job correctly, so we can end of treatment for that particular phase, on to the next or whatever it is. So we've always had that. But what do you do in a post-operative treatment 4 that has anything to do with internal marketing?
Okay, in your final post-operative treatment, you know, the typical thing we do is we go check margins, we check occlusion, make sure there's no cement below the gum line in an implant case, and say goodbye. It's a real quick visit. No, it's a real long visit. The patient is happy. The patient has completed treatment. The patient doesn't have to see the dentist anymore. The patient can chew. The patient can smile. It's exactly what you wanted. Don't you think it should be a good idea, or it might be a good idea to take advantage of that happy moment? That is one of the biggest happy moments and the biggest strategies that we have for internal marketing in our practice. And it costs absolutely nothing, or relatively nothing, because we celebrate with the patient. We do a graduation ceremony. And yes, I'm going to show you the graduation ceremony, but not now, but on the next webinar. We're going to talk about exactly what I do. Now, you may not do it exactly the same way as I do. You may decide to assign a staff member to do it. But if you're not celebrating, and just take a look at any restaurant and how they celebrate birthdays, if you're not celebrating, you're reducing an opportunity to get that patient to write the best success story that he or she possibly can, because they're so happy after the celebration, to write the best Google review they possibly can, to take the charitable giving campaign and the care to share cards and want to share it with somebody because they want that next person to have the same happy experience that he or she had. So there's a lot of strategy in making sure your final post-op is used as well as possible in order to be able to encourage all of these other campaigns that we've talked about over the past couple of months to actually be implemented.
Yeah, and with the post-operative forward checks that we do, yes, it's a celebration, and it's loud, and the whole office knows when we're doing it, and it's probably it's pretty exciting. It's pretty exciting. I don't know if it's more exciting for us or the patient, whatever it is, but during this time we give the patient stuff. And it's not expensive stuff. Some of it's funny, some of it's fun, some of it is good stuff. It has.
Don't give it away. We're going to do it in a couple of weeks.
But it's so neat. So we're giving them stuff. We're giving them stuff. But also,
I'll tell you one of the things we give them. Take a look. You see that right there?
That's a
so
sneak peek.
There's a hint.
But also, with doing this, at the very end, we're having them write a success story on their treatment. So how it was like when they came in. How was it like during the whole process? How happy are you now? How likely are you to refer us to somebody? And they're great stories. And what do we do with those success stories? What do we make with those success stories? We have those printed. We have those on the website. We make those into books. We have pictures that we take with those. There's a lot that we do with that, which I won't give it away. We'll do it the next webinar, even though I'm so excited I want to show you. But we'll show you that next webinar so you can see what you get from it and how you can use that for more referrals.
Well, I don't mind talking about part of that,
Okay.
because the pictures are so important.
Yes.
You know, we talk about how important it is and we've talked about this in the past, is how important it is that pictures of happy patients be there when you're trying to tell the patient that you need $25,000 worth of treatment.
You're right.
And if over my shoulder, if I'm the patient, or over your shoulder, if you're the FA assistant and I'm the patient, if I'm saying smile after smile after smile
with the doctor,
yes, and then the two of us are smiling
Beautiful
together,
smiles.
or three of us, or four of us are smiling together.
Right.
Yeah, I mean, what a difference that would make. Assume that you were a buyer. Think about your being a buyer and you're being able to say, I want to buy from that person. Isn't that one way to see that person smiling along with the doctor? Isn't that a good way of doing that? And so taking that picture is extremely important.
It makes it more real to a patient who has not yet had it yet. So yes, when they're sitting in the financial room and they're getting ready to make a decision on if they should spend that much money with you, and behind, like he said, the FA person's shoulder is this video alternating photo book of, I don't think it ever repeats once during the whole thing. There's hundreds of patients on there are smiling, are so happy, and they're holding all these great prizes we've given them. They're just excited. It shows that you're real. It shows that you are going to give them that final product that they're going to love, because you've given it to all those patients. So would it make up those patients? There's too much there to make up. It's good. So you're making it real to them. You're making it something where I want that. That's what I want. I want to be smiling one day with him, with that free gift in my hand and all the stuff that they're celebrating. So it makes it real to them. Okay.
So in the next webinar, we're actually going to do that ceremony. We're going to show you exactly how that ceremony goes. and you can adapt it to your life, your way of operating as well. You don't have to do it exactly the way I do it, but do it. Make sure that this becomes the POT4 becomes an event. What else?
And there's also things that you can do with your staff to encourage those internal reviews or internal referrals. So like Dr. Sheldon says, what can you do with the staff that you've trained to be dedicated and to know you, love you, trust you, have that ownership attitude? How can you have them bring in patients to you? Because you know what they're going to say is real. They work there. They know that doctor. They know that place. So what can you do with them? So we have a staff referral bonus and we have a hygiene referral bonus. And how are those different? For the hygiene referral bonus, it's already established patients. It's patients that are already coming to your office for cleanings every 3 months, 4 months, 6 months, 12 months. So they're already a patient of yours, but we are offering a 1% bonus to the hygienist of the plan that's being accepted to actually get something back from that. So when the patients are coming in and getting their teeth cleaned, if the hygienist is noticing the missing tooth, talk about dental implants. You know, you really should talk to Dr. Sheldon about getting an implant there. It will help you with this, help you with that, help you with that. They know, and they have a whole hour to talk about it, the benefits of treatment, benefits of Invisalign, benefits of bleaching, benefits of crown lengthening, benefits of whatever it is. They have a whole hour to sell our practice with that patient. And so if that patient schedules, comes back to see you, and then we close the treatment for them, they get that 1% bonus. And so that's a way for them to have incentive to talk about this stuff. Instead of talking about their vacations, their trips, or nothing at all, it gives them incentive to talk to the patient about treatment. We also have the staff incentive. So for the staff incentive, this is a patient that's never been to our office before. So they're at a birthday party, they're at the mall, they're at a restaurant, they're talking to their neighbor, or even their family, and someone complains or says, hey, what's that logo on your shirt? Where do you work? Or complaining about something cosmetic. Maybe they compliment my smile and I say, hey, I know where you can get one like that. So it's having your staff ready to sell your practice, sell your doctor. And for that, we give staff a 3% of the sale bonus for getting that patient to come in. And maybe it's a $25,000 treatment plan. Maybe it's a $5,000 treatment plan, whatever it is. But that is what we give them incentive to carry those care to share cards, carry their business cards, do something outside the business to promote our practice.
Yes. You know, as many of us say, well, staff should be doing that anyway. And yes, staff should be doing that anyway. I agree, but you know, there is some ownership that the staff can take. And frankly, if we give that staff member a nice reward for doing that, it's going to encourage that kind of behavior. Really, really important.
Yep.
Anything else on
That's
our
what
list?
we have. That's what we have.
Okay, so our next webinar, we're going to talk exactly about how we implement each of those steps and how you can implement those steps too.
We hope you have enjoyed this video. If you have any questions in regards to it, please email us.
The American Association of Independent Periodontists is there to help every periodontal practice do better. I'm Dr. Lee Sheldon.
And I'm Danielle Joyner. We'll see you on the next video.
Okay, so first of all, what is a POT4? POT, of course, is post-operative check. 4 is the fourth one. It's something that we had more so in place as far as the numerical value of that a long time ago, where it's the fourth time they come in is happened to be the last time they come in. But now we just have it as an indicator of the final check, the last check, when their treatment, when that particular treatment has ended and Dr. Sheldon's going in to check it, make sure it's good. It's that final check. So after that, they're just going to come back in for a cleaning, or maybe they're going to start a different phase of treatment. But it's their final check after a treatment has been completed. So what we were kind of focusing on here is taking advantage of opportunities. Taking advantage of the opportunities when they arise to ask patients for referrals, to ask patients to do a Google review, to ask patients to write a success story about their experience in your office, to talk about the Care to Share cards to give the people that they may know that want to come see you, or the charitable giving campaign, which we talked about before, about how they can have people come see you at a discounted rate for an additional special rate. You have finished with their treatment. They're done. They have their final product. They are more willing than ever to tell people about you, tell people to come in and see you and sell you. So this POT4, which is the final check, talks about taking photos. We mentioned that here in this video. We're not talking about headshots. We're talking about happy, active photos of the patients with the doctors with these gifts, and they're almost laughing pictures of these together, doctors, and patient. And we'll go over that more next week. But this is when you take these happy photos, and it's to put on your website. It's to put on these rotating photo books in your reception room, in your financial rooms. This is the best opportunity to take these photos. We talked about success stories in this video. And success stories, again, we'll go over more next week, but get success stories during this time. Again, this is your opportunity to get a good story, to get them to take the time to write a good story. This is when they feel most grateful, most excited about the investment they made, the product that they have. You can use these on your website as well. You can get quotes for marketing actions. You can put a success story book binder together for your reception room where nervous patients are looking at stuff and they would love to read this. Because honestly, in the field that we work in, there's not very many opportunities to have that patient excited to come in, because usually they're coming in to pay for treatment. They're coming in to hear that they need more treatment that's going to cost money, or they're coming in to have a procedure done, which is probably going to hurt. You need to create the opportunities, which we did with this POT4, to gather all of that, because unless they're coming in for a cleaning, they're coming in for something they're probably not looking too much of, they're not looking forward to. So create that just like we did, and next week we will show you exactly how to do that. So Dr. Sheldon, I have a question for you on this video. Okay. So what is the clinically, what are we doing at a POT4?
Okay, so POT4, let's assume it's an implant case. So here are the critical things that we're checking. Number one, if it's an implant case, we're taking a periapical x-ray, number one. Number two, I would look at the periapical x-ray, and I want to make sure there's no cement. But as you know, some of the cements are radiolucent, and so, you can't necessarily depend upon just that. But certainly I'm looking for mucositis. I'm going to probe around the area and make sure that any sign of cement, and there's a good article by Linkevicius, I believe, talking about, Tomas Linkevicius, I think is his name, talking about the percentage of patients who have cemented in crowns and peri-implantitis. And the relation, and the comparison of that to screwed in crowns is just tremendously significant, because we're seeing in the order of 20 to 30% of patients who have peri-implantitis, or the beginnings of peri-implantitis mucositis, on patients who have cemented in crowns, and only 1% of those who have crowns that have been fixed in place without cement, with the screw, with the UCLA type of crown. So I hope and anticipate, and we're doing it too, that if our angulations are correct, we're trying to eliminate the abutment, eliminate cement as much as possible, because we're guaranteeing our implants. So that's important. So besides checking for cement, I'm certainly going to check margins to make sure there are no open margins, certainly no grossly open margins. And the third thing I'm doing is checking the occlusion. And when we're checking the occlusion, I check with shim stock. So for those of you who don't know, shim stock is a thin piece of cellophane. It's usually it's about 5 to 7 millimeters in width, and essentially I'll place the shim stock between the tooth and its opposing tooth and see whether that's in contact. Now, shim stock to me is very, very important in examination. With one of our consulting clients, we had that discussion last week. We have to know which teeth are touching. We do. I mean, if we're looking at it not as periodontists but as a dentist, we have to know about the occlusion. And one of the things that we find, and one of the things that you find, and I know you find it if you look for it, is that very many of the crowns that are placed in hypo-occlusion or not in occlusion. You'll see that in crowns, you see that in standard crown and bridge. And we've got to be aware of that. You know, it's something that we all struggle with. And Danielle knows darn well that I struggled with it too. But the bottom line is the patient is my patient. And if the patient is my patient, then the patient needs, then I've got to look at that patient. And if that crown is not in occlusion, I can't shrug it off. So if I have the patient bite down with shim stock and there's no contact, then I'll put the shim stock back in. I'll say, now clench, and let's see if the crown is in occlusion. And if it is, that's fine. If there's a drag, or if the shim stock holds tight when I try to pull the shim stock out when the patient's in clenching, then that's great. Still, if that doesn't work, then I will take a piece of Meinol articulating paper, and I'll cut that down so it's about the same width as the shim stock, and I'll put that in the mouth. Meinol articulating paper is a little bit thicker, okay? And I'll have the patient bite down, and then if that Meinol articulating paper drags, or if it's in occlusion, then fine. But if when the patient bites down, the shim stock easily comes out and the Meinol articulating paper comes out, it's my duty to tell the general dentist that in fact there's something that's askew here. After all, we put in the implant for a reason. It wasn't just to hold the space. It was to allow the patient to chew, but it's also to take the stress off of the adjacent teeth. And if that was the reason we're putting the implant in fact the implant is not in occlusion, and you know, there's some teeth where it's not critical for the implant to be in occlusion. Certainly we could talk about the anterior teeth and it's not as critical. But if we're talking about posterior teeth and they're not in occlusion, essentially the implant isn't doing its job. So it's either a call to the general dentist or it's a letter to the general dentist saying, please check the occlusion on this. Here's what I found when I checked it with shim stock. Okay? And by doing that, there's a legal record, by the way, because you're there to help the patient. And if you find that it's in for occlusion, and you know it, and I don't identify it, you know, this covering the rear end of everybody is getting us. That's what got us where we are today. It's got where we are today. It's essentially, oh, you know, we got to protect the general dentist and not the patient. That's why, or one of the reasons why we're having trouble. So yes, it's difficult to confront. You'll have to come up with your own skill on how to do it. But if we're looking to preserve integrity in dentistry, then if we find something that's not working, and I hate to be preachy about this, but I am, the patient has to know. And so essentially I'll say to the patient, listen, you know, I see something here. I'd like your dentist to take a look at this. Okay? What is it? Well, you know, I'm going to write a letter and just let the general dentist know, and let the general dentist take a look at it, and then, you know, he or she can decide with you if anything needs to be done. And that's as far as I'll carry it. And then of course the written documentation that I told the patient to go over and see, and go back and see the general dentist, essentially then is the legal document that essentially protects the patient, of course protects you.
Right, and we do that letter for every single patient that has this POT4, and it's either a letter to say everything's perfect, beautiful, thank you so much, patient's happy, or it's a letter to say, okay, we need to look at something else. And so we abort the whole POT for the ceremony process at that time. If we're not celebrating its final, then we're not celebrating. So we just say, okay, we're going to have you come back in 2 weeks. We're going to call over to your dentist. We're going to have you just do a quick visit back to see him. We're just going to do something else, you know, to the crown or whatever it is, and then you're going to come back again so we can check it again. For us, what I found is we gained the respect of the patient that, you know, we caught that, and we're not going to just accept this. And even when they did say something in the means of, oh, I have to come back here again, once we just explained, listen, we want to make sure this is perfect. We promised you a good result. We promised you that you'd eat better. We promised you an implant that's going to last you probably a lifetime. We want to be sure we can get that to you. And they understand that. So we never had anybody angry. But same thing with the dentist. You're going to earn the respect that, hey, he's going to make sure this is done right, And if you're not earning their respect and they're getting mad, you probably want to cut them off anyways. And I know that's one thing for Dr. Sheldon that was the last straw. That was where he just could no longer do this anymore, was when, if he had dentists, and there were a few that didn't like that response, that either didn't want to do it, and they always did it, but some didn't want to do it, or they argued the point on it, but they still did it. Like I said, Dr. Sheldon would never accept it not to be done. But that was when he was just like, forget it, just forget it. We're going to advertise the patient off the street. They were a bigger, better patient. We still have and had the referrals from those good sources that we liked working with. The only ones that we lost are the ones that we didn't care to work with anyways. But we have to do the ethical thing for the patient. We promised it, and it is our patient, and we have to deliver what we promised, and that's what we do with this.
Good. Any other things that came up? I think, by the way, if we're talking, we're not going to end this on a negative note. I'm sorry, we're just not going to do it. It's important that, and I dictate all my letters. It isn't something where I'll type it into a machine, or I have I have some kind of a letter form. I'm checking boxes. I know that's done, and that's fine. I would much rather talk into a dictating machine, or into a dictating machine. Boy, that's an old term, isn't it? I'd rather talk into a digital recorder in front of the patient saying, hey, Dr. Smith, you did a great job. And I'm saying that right in front of the patient. So that letter is going to Dr. Smith. It's going to be typed out. Say, Dr. Smith did a great job, or you did a great job. And the patient's hearing me say that too. And I do that. In fact, I do that every chance I can get. And the dictation is always done in front of the patient. So the patient hears what's going on. We're seeing new patient examination. I'm dictating the sequential treatment plan at the chair. Right. So almost all the time, not every time. Sometimes I just drag someplace else and I have to do it. But I mean, but the intention is to do all of this dictation at the chair, and it's complementary dictation, and it's what the result, or what the problem is, and we've gone over awareness characteristics, ruin all the way up to help. And so we talk about the problem, and then how we're going to help that patient, and what difference it's going to make for the patient. That's all part of the dictation. Right. For some of it's going to be a little bit more of a struggle than others. I mean, you're thinking through a treatment plan, and now I've got to be able to dictate, and I've got to be able to speak off the cuff, much like Danielle and I are doing right now. And some are doing better than others, but I can tell you this, just as in anything, as you do it more and more and more, you become more and more comfortable getting this done. And in terms of PR, in terms of confidence level that the patient has in you, frankly, in terms of confidence level that the staff has in you, and particularly if I'm doing an examination, for the staff and the patient to hear the same thing as I'm dictating the letter, that kind of reinforces the entire treatment plan that I've already developed. So for the younger, or even the younger at heart, I would encourage you to gain that skill, gain that facility, if you choose to dictate your notes. If you don't choose to dictate your notes, maybe you can do it in a different way. But I don't give up on dictation. There are certain companies that have these drop-down boxes, and I don't give up on dictation because, frankly, for that reason. I think it's so effective to be able to talk about the patient in front of the patient, talk about the great doctor in front of the patient. It makes a tremendous difference.
Yeah. Well, that's all that we have for this evening. Next week, please tune in so we can show you, or we can dissect that POT for a segment for you to show you what we give, what we say, a video on us actually doing one, and that way you can start doing those yourself.
Good. See you next week.
Have a great day.